Hello, everyone. My name is Reed-Arzavala Reed, and this is my discussion presentation on an active shooter response. So the scenario is Hello, everyone. My name is Reed-Arzavala Reed, and this is my discussion presentation on active shooter response. The scenario, as you all know, you are activated to respond to an active shooter incident at a local high school. You've been informed that there are more than 24 individuals who have been shot and 7 confirmed fatalities. You are assigned to provide disaster mental health support to students, faculty, and staff who have survived the incident. You are meeting the survivors in the school gymnasium. Responding to an active shooter incident is a stressful situation for everyone involved. Unfortunately, with the infrequency of school shootings, even with the rise of violence and mental health issues with teenagers, there is inadequate training to properly support survivors of school violence and shootings. This may be the reason that outside sources are requested for expertise and well-rounded support. Brown 2020 states that the counselors responding to a school shooting should be prepared to lead, expect dual relationship role conflicts, utilize counseling techniques, and minister to thyself. Organization, in my opinion, is very important. Organization and level-headedness is necessary to maintain peace and order to facilitate safety and healing. In a crisis situation or traumatic experience, remaining calm, collected, and in control of one's emotions can model emotional regulation and promote trust, safety, and security with the survivors. SOTA, as we learned in our readings, according to Jacobs 2016, using the SOTA acronym for problem solving in a crisis situation is vital to being an effective support system. The first stage of SOTA is stop, to evaluate properly and prepare accordingly. In most emergency situations, time is of the essence, which is true. However, an ill-prepared, unorganized emotional disaster response does not bring comfort or promote trust in the leadership and healing facilitators. Quite the opposite, moral injury occurs when subordinates lose trust in leadership during crises due to decisions based on split-second reactions and resource availability, especially when the outcome is undesirable. Together with the staff and administration, coordination of protocols and decisions on what comes next should be discussed and agreed upon before addressing the gymnasium full of survivors. It is important to remember, as a counselor, the staff and administration are also survivors, and some students are the perpetrators. Addressing the survivors. Start by introducing the staff for those students who do not know them, especially the administration, and introduce myself with a brief description of what I do and my purpose for being there. Reassure everyone that is support for them now and in the weeks to come. Inform everyone of the latest updates on school closures, when and how their parents can pick them up, and the status of the shooters and their injured classmates to promote full transparency and build trust with the students. Educating everyone on what feelings and symptoms they may experience in the days, weeks, and months to follow may encourage everyone to talk about their feelings and experiences with trusted adults or friends to reduce long-term effects. Encourage everyone to take note or monitor their eating and sleeping habits to maintain as much of a routine as possible, which will maintain healthy habits. Strongly suggest everyone come talk with me individually, one-on-one, but I would not make it mandatory. Briefly discuss how this whole experience is no one's fault. There's no understanding or rationalizing the event that just took place, and encourage everyone to work together to get through this and continue moving forward. Teach a few grounding exercises to the entire group, going further into detail and demonstrating deep breathing exercises all together. Conclude the group by offering up my contact information and letting them know how they can get a hold of me in the days following, especially once they all return to school. Pass out a list of local resources for other counselors and support groups in the area for students and families who may need more support than what the school can provide in a more timely fashion. The power of prayer. I would conclude the entire group meeting by leading a prayer aimed at hope and resilience to encourage positive religious coping, because resilience is born in a world with so much suffering. Romans 12:12 says, rejoicing in hope, patient in tribulation, continuing instant in prayer. Thou shalt never feel alone with the Lord Jesus Christ, walking beside them through darkness, guiding back to the light with hope and faith. I would then, after all of these overviews and explanations as an entire group, I would have the students separate into smaller groups and have a teacher or administrator or staff of some sort be a leader in each group. And depending on how many students to staff ratio, I might have a handful of staff members per group. Each of the teachers would then go through the psychological first aid concepts with the groups, while I would go from group to group offering secondary support, a new perspective, further assistance to the teachers, answering any questions that the students may have. And I think this would also give me a good idea of who might need more individual one-on-one support. So as we learned in our readings, the psychological first aid includes these steps here: contact and engagement, safety and comfort, stabilization, information gathering, practical assistance, connection with social supports, information on coping, linkage with collaborative services. So a lot of this would have been covered in our massive group overview, but definitely a little bit more in detail in the smaller groups. I think students would feel more comfortable opening up with a handful of their classmates and teachers one-on-one. And for those who obviously need the help and don't want to discuss in the smaller group settings, that's where I would come in and offer one-on-one time. Refer to the teachers as to which students may need further assistance. They know these kids better than you would, so they should have a pretty good idea of who seems to be struggling more, who's a little bit more off. And this is not just in that moment, but in also the days or weeks to come. Everyone's going to be experiencing different symptoms following the school shooting. Let's see, to offer one-on-one consults, following through with Jacob's steps. The next step is O for options. So brainstorming the options with the smaller groups can then help reevaluate the decisions made by the school board and administration prior to this, to adjust any of those decisions into more appropriate ones, as well as provide resources based on the students' needs that hopefully were discovered within the smaller groups. And then from there, final decisions, which is the D for soda, can be made on the school support, class structures, school closures, how long it's going to be closed, when they will come back, how it looks when they come back, and then those decisions, how they'll be acted upon, which is the A for soda. This will also be dependent and unique to each student's needs if individual sessions reveal further support and exceptions are needed. Once parents have arrived, a handout of resource options will be provided to the parents, and the students can then be released into their custody to go home. Rebuilding. Following a school shooting, students struggle with higher levels of anxiety, depression, and PTSD, as well as poor focus and performance. Changed protocols, increased security, and more student support to include mental health focus typically follows a school shooting incident. Gregory and Park suggest expanding access to counseling, increasing training of school personnel on threat assessment and mental illness using interdisciplinary threat assessment teams, monitoring and following up on treatment plans, expanding involuntary treatment, implementing bullying prevention, and increasing interdisciplinary communication. And thank you very much. I look forward to reading all of yours. These are my references here, and it's been my pleasure.